Eastern Cape Health Department says it will unveil a state-of-the-art oncology equipment at Livingstone Hospital in Gqeberha. Over 36,000 cancer patients were recorded in the past year in the province, with over 900 new patients being treated at Livingstone Hospital for different types of cancer. The new equipment is set to assist with the fight against this non-communicable disease. SABC News reporter Lwando Nomoyi has more.
Well, a step in the right direction here at Livingstone Hospital in Gqeberha, where the Department of Health in the Eastern Cape has unveiled a state-of-the-art multi-million rand equipment for the oncology unit of the Western region. We do understand that this particular handover of this equipment at the value of 60 million rand will help in eradicating the backlog that is currently being faced and the waiting list for many cancer patients within this particular region. But in discussion with me, I do have Nomoyi, the acting manager of radiation therapy in the Nelson Mandela Bay region in Livingstone Hospital. Nomoyi, thank you very much for your time. Let's just discuss this particular intervention by the department.
Well, today is a very exciting day for us that we are able to unveil this baby of ours that we've been asking for years, that we need a new linear accelerator to treat our cancer patient. Especially the old one is giving problems, and we cannot effectively treat patients because of sometimes we do not have SLAs that are in place. Sometimes there's a lot of equipment or machines that actually breaks, and we cannot get them from around town, from locally. So this one is able to, whenever there's a problem, we are able to come and treat patients on this one, and it's much more effective, much more faster. We are able to do a lot of modalities, a lot of treatments on this side. Like we can do stereotactic radiotherapy, we can treat EV-MAT, we can do 3D, we can. It's very good. And this one comes with a cone beam CT within, which means we can able to do adaptive treatment. We can take X-rays and make sure that cancer has not spread, and make sure that there's no changes within the area that we are treating. So it's giving us really goosebumps just to think about what we are receiving today. Yeah.
Just also in terms of the number of patients you will be able to service a day, what can you tell us about that in terms of the number of patients that you guys can assist, every day using this particular technology?
Well, the number of patients that we can be treated on this unit is about 50 patients, because it is fast. Because it's fast and is able to deliver the radiation that we need, and we can actually operate it from outside. That makes it so unique, and it's not like the other model where we had to come inside the room and change the setup and do any of those things. But here we are able to do everything from outside, so it actually makes our treatment time shorter and faster, because then we can treat about 50 or 60 even, depending obviously what kind of cancer that we're treating, which area that we are treating. Yeah.
Although it's a multi-million rand investment, do we have enough boots on the ground to man this machinery?
To be honest with you, we do not have enough staff. We do not have staff. Currently, we are sitting with 6 radiation therapists that are actually running this unit. To be able to operate both machines, we need about 12, in fact, the whole department. To operate the whole department, we need about 12 to 13 radiographers running this unit. But this unit itself, we will need about 4 RTTs, if not 3, to be able to run it optimally. Yeah.
Let's just speak in terms of the training. Is there sufficient training that you've been given to operate these machines, and when can we expect you guys to go live with it?
Luckily, the specifications came with training, because they cannot give us a big baby like this with no training. So we've had the phase 1 of training started 2 weeks ago, where we did VMAT training, and now we're just waiting for our physics department to actually commission our planning system, so that we will be able to plan and treat patients this side. But we are looking to actually start going live around about last week of June, beginning July. So it is go live is soon. We are very excited for that.
Thank you very much for your time.
Thank you so much for having me.
Nomoyi Tumongo, the acting manager for the radiology
Radiation oncology
unit here at Livingstone Hospital. Just briefly unpacking to us some of the good deeds this machinery will actually do for the people of this region. But from us here, it's back to you in studio.